How's the royal family? I pray that everyone is doing well. Well, my royal family, this video is about karma. Now, this is Florida Governor Ron DeSantis. That's the best that I can pronounce his last name. And the reason why I'm saying what I'm reporting to the royal family about karma, let's keep on our frontal lobe how nasty he treated our brothers and sisters in the Caribbean when they had that horrific hurricane. And I mean, it was horrific. It literally wiped them out. And him and Trump made sure and made a point of saying they didn't want none of them over there. And I was telling Lisa Cabrera behind the scenes that, because we know this is one of Trump's lapdogs, that he gonna pay a heavy price. So we know that he's been very defiant during this coronavirus pandemic. And the only thing that's on his mind is money. And what I'm about to present to the royal family is basically juicy. But it's terrible that the citizens of Florida have to pay a heavy price for his stupidity. And then people individually have to make executive decisions. So I have an article that I'm going to read, a couple of videos that I'm going to present to the royal family, and also an audio that is quite deep. So my royal family, let me get into this article. Coronavirus forecast. Researchers said Florida could become the next outbreak epicenter. It is the epicenter, my royal family. Once y'all get the full report here, you will fully understand. Now, let me see. Let me get the date on this. Okay, this article was done June 18th, and today is the 22nd. While coronavirus cases are increasing across Texas, North Carolina, South Carolina, Arizona, and other places, one state is showing signs that it could, and it has now, became the epicenter of the U.S. outbreak, Florida. Oh, and they're going to downplay it. The state has all the markings of the next large epicenter. The risk there is the worst it has ever been in our projections, researchers behind a coronavirus model put out by the Children's Hospital of Philadelphia and the University of Pennsylvania wrote in a recent blog post. Miami and Florida southeastern counties now join Tampa, Fort Myers area, and Orlando for a fairly widespread transmission event that will continue throughout the state. They continue. Florida health officials reported nearly 80,000 cases of the virus and more than 3,000 deaths. The state's new cases are trending upward, with officials confirming 3,207 additional cases of Corona-19 Thursday, setting the record of the highest daily total. The previous record was set on Tuesday with 2,783 infections. However, Florida Governor Ron DeSantis has indicated that the recent spikes in cases will not make him hit the pause button on reopening the state. No, we're not shutting down. We are going to go forward, DeSantis said Tuesday. He said we have to have society functions. Let's not lose sight of this. This fool said WW whatever wrestling, that's essential. That is essential. That is a must. This is a must. You have to have this. As we continue on, let's see here. But Florida isn't the only area demonstrating patterns that worry the model's researchers. They said that we also now see the full effects of the increased holiday travel, hammering southeastern vacation destinations, adding the Hilton Head and Myrtle Beach, South Carolina, are particularly concerning, as well as Galveston, Texas, and Lake Charles, Louisiana. Some positive signs have been recorded in Houston, Phoenix, and Salt Lake City, as well as Nashville, Tennessee, and Richmond, Virginia, likely due to social distancing, according to researchers. Ultimately, we have the early evidence of more vigilant behavior we're observing in some hotspot signals that many people are beginning to understand summer weather alone cannot extinguish an outbreak, they wrote. High temperatures and humidity help to reduce coronavirus spread on the margins, but the greatest difference is our social distancing and masking, hand hygiene, and the ability to protect high-risk locations like meatpacking plants, prisons, and nursing homes. Now, what I just read, this stuff can fluidly change, literally in a day. Literally in a day. Literally, no, let's say within hours, even possible seconds. So let's get into this first video, my royal family.
In our health lead today, with the 118,000 plus in the United States dead from coronavirus, a number that keeps sadly growing, President Trump falsely told the American people that coronavirus is, quote, fading away. That's not true. 10 U.S. states are seeing their highest number of new cases since the crisis began, and some health experts say one of those states, Florida, could become the next epicenter of the pandemic in the United States. But as CNN's Erica Hill reports, every state is continuing to reopen. And one source tells CNN that the White House is simply in denial.
Record single-day highs for new cases. Just over 2,500 added in Arizona, more than 3,200 reported in Florida today.
Florida has always made the stuff of nightmares, I think, for me.
New modeling predicts that state could become the next epicenter. The president dismissing the data.
If you look, the numbers are very minuscule compared to what it was. It's dying out.
One of the problems we face in the United States is that, unfortunately, there is a combination of an anti-science bias that people are, for reasons that sometimes are, inconceivable and not understandable, they just don't believe science and they don't believe authority. And that's unfortunate because, science is truth.
Florida is one of 10 states posting their highest 7-day averages for new cases, as 23 states report an uptick in new cases over the past week.
This thing is real.
In Texas and Arizona, governors refusing to mandate face coverings statewide as local officials push to add their own, citing the solid science.
Wearing a mask or not wearing a mask shouldn't be how you're going to vote in the upcoming election. It's really about protecting yourself from an infection.
When it comes to infection, those with type A blood have a higher risk of catching the virus and developing severe symptoms. Type O has the lowest risk, according to new research just published in the New England Journal of Medicine. Football likely sidelined this fall. Dr. Fauci telling CNN's Dr. Sanjay Gupta, unless players are essentially in a bubble, insulated from the community and tested nearly every day, it would be very hard to see how football is able to be played this fall. The NCAA just approved plans for preseason practice. College football still slated for kickoff on August 29th.
And some big news out of California. Governor Newsom saying that face coverings are now mandated across the state, and that would supersede any local ordinances. He said he's just seen too many people without face coverings, and that, Jake, he doesn't want to risk losing the progress that's been made.
Joining me now is CNN Chief Medical Correspondent Dr. Sanjay Gupta. And Sanjay, we should note that previous predictions that Florida was going to be hit super hard did not come to fruition at that time. It was not hit as hard as New York was in March or April. These are new projections from the Children's Hospital of Philadelphia and University of Pennsylvania showing that they think that Florida could be next. Give us your best assessment of what might happen.
Yeah, I mean, I think the reason New York was hit earlier, it's a coastal city, big airport, international airport. They had a lot of people coming in that were probably carrying the virus. That's why some of these places, including Seattle, California, were hit early. I think there's always been concern about Florida, a lot of travel back and forth, but then you superimpose on that they closed late and they opened early. I mean, this is well known. I mean, as more people are out and about, either closing late or opening early, you're going to see the rate of infection increase. I think the real concern from a medical standpoint, Jake, is that the numbers are going to go up as places reopen. We know that. Florida's we got a more vulnerable population, a more elderly population, people more likely to have pre-existing conditions. And remember, flattening the curve was all about trying to keep people out of the hospital. It's harder in a place like Florida, especially when you see as quickly as the numbers are rising there.
Florida joins 9 other states, including Texas and Arizona and both Carolinas, that are seeing right now a record high 7-day average of new cases per day. Texas also reported a record number of hospitalizations, but none of these states are retracting in terms of the reopening measures. Do you think they should? Should they? I mean, that happened in South Korea. They would go to phase 2, then there'd be an outbreak, they'd take a step back, bring it back to phase 1. Should these states consider that?
I think they absolutely have to consider this. I think that they may not be able to make that decision in a while. If the numbers go up, significantly higher, the decision may get made for them in terms of just the virus circulating as quickly as it might. I think that, the thing that strikes me, Jake, is there is a middle ground. It's not just open or shut. And we've talked about this for months now, but the idea of wearing masks and physical distancing, we have plenty of data from around the world that it works. And yet, the people who are so against, I think, shutting things back down are also the people who aren't doing anything to prevent that from happening, right? By actually really advocating and even mandating these masks and physical distancing. We're seeing a lot of behavior that's just going to cause the virus to spread even more.
One Trump administration official, an individual who's close to the coronavirus task force, told CNN that the White House doesn't want to, quote, deal with the reality of the fact that cases are rising in that country. And there's a Wall Street Journal interview in which Trump said about Oklahoma, the numbers are very small. They said there's a spike. The spike is, I wish Mike Pence were here because he was showing me the numbers before. It's like very few people. And I think they're in great shape, but I would even say the spike has already ended. That's not my understanding of coronavirus cases in Oklahoma, where the president is heading on Saturday. How is this going to get solved if our leaders just will not accept reality?
I don't know how, you can look at numbers. They are numbers. They tell a very clear story. The numbers have been going up. 20% of Oklahoma's total coronavirus infections have happened over the last week. I mean, the health commissioner there, health officials there are very worried. I mean, it's clear as day. I mean, this isn't even a debate. Maybe it's going up, maybe it's going down. It's going up, clearly. And by the way, if you look at the country and you say the numbers are small, that basically means that we are okay with 20,000, 25,000 people a day getting infected, hundreds of people dying. You're basically saying that's as good as we can do. That's it. That's our basement. We know numbers are going to go up as we start to reopen. So you're saying that's become the bottom of what we can actually achieve, which is ridiculous. You got to pay attention to the data here.
Dr. Fauci said this morning that there's an anti-science bias in the United States that makes treating the problem more difficult. Now, he was not specifically talking about President Trump, but frankly, if you look at President Trump's track record when it comes to science, whether it's weather science, in his Sharpiegate or his lies about vaccines and autism, this isn't a guy who has a lot of respect for scientific fact.
Yeah, I mean, I think Dr. Fauci, is seizing on something that a lot of people have been saying for some time. I mean, the anti-science is there, with regard to climate change, with regard to the environment overall, I think, in terms of deregulation. I think, so the anti-science sentiment is not new. I think what is different is this is a very urgent situation. I mean, this is right now. Bad science could lead to really bad decisions, and I think history books are going to get written, Jake, about some of the decisions that are getting made right now. and they're going to be pretty scary books to read.
Yeah, and the U.S. has something like 4.5% of the world's population and something like a third of the world's deaths due to coronavirus. Sanjay, thanks so much.
All right. Let's shut that down. So, what I was thinking about my royal family in this particular video, I was thinking about Pharaoh. And, you know, we know that story very well in all the series of events that Yahweh put those people through, period, but let alone Pharaoh. And Pharaoh stayed in a state of denial. And I'm going to go back again to what Big Judah was saying about this coronavirus, is that, you know, we're not seeing the unquote leaders, Trump, and then as you go from state to state, how they're dealing with it. They haven't caught it yet because a lot of them are being defiant and they won't wear a mask and all these different things like that. And he was saying that, no, they will be the last, because he wants the enemy to see their kingdom die before their eyes. So they got this way of thinking that just their sheer thinking that this will go away. This dude is racist and dumb, and you can see both of them on his being. Oh yes, you can see it. So let's get into the next video, because I want y'all to hear what comes up out of this fool's mouth. So we're not going to listen to this long audio here, which is 34 minutes. You don't really want to hear that. I do have something. I got that a little bit mixed up. So I want y'all to listen to this little over 7-minute audio.
What to know in South Florida on June 21st. We're keeping track of the latest news regarding the coronavirus in South Florida and around the state. Check back for updates on COVID-19 throughout the day. DeSantis says state still has plenty of hospital beds. 3:15 p.m., even though case counts of COVID-19 continue to increase across Florida, Governor Ron DeSantis has pushed back against notions the state could be the next epicenter for the coronavirus. On Friday, the governor asserted Florida still has plenty of hospital beds available as the median age of those testing positive has dropped to 37 for June, DeSantis said. Still, hospitalizations have trended upward in the last few weeks, and public health experts worry hospital capacity could become an issue down the road if the virus continues to spread unchecked. While it's good that the hospitals feel like they have the bed capacity to cope with a surge of cases right now, I worry that this capacity is going to be tested over the coming weeks if COVID-19 spread continues unchecked. Dr. Jonathan Grad, a physician and professor of immunology and infectious diseases at Harvard T.H. Chan School of Public Health, said in an email. Read the full story here. South Florida Youth Symphony adjusts to virtual world. 2:15 p.m., the South Florida Youth Symphony was supposed to fly to South America in March to spend a week performing in Argentina and Uruguay. Less than 2 weeks before the trip, the COVID-19 outbreak began. The Youth Symphony quickly had to learn how to operate in a new socially distant world. The adjustments have been similar to the ones many people have used. The orchestra has fallen in love with Zoom video communications to continue rehearsing as a group, and it has even taken to hosting virtual concerts on YouTube and Facebook. Another is coming later this week, and a third will follow in July. Read the full story here. Florida's updated case numbers. 1:15 p.m., Florida's Department of Health on Sunday confirmed 3,494 additional cases of COVID-19, the highest Sunday total since the coronavirus pandemic began. It brings the state's total case count up to 97,291 cases. There were also 17 new deaths announced, raising the statewide toll to 3,161. The Sunday case numbers typically run a bit lower than other days of the week. Miami-Dade County reported 710 new cases of the virus and 10 new deaths, and Broward County reported 318 cases and 3 deaths. Palm Beach County reported 248 new cases and Monroe County reported 4, and neither of the South Florida 2 counties had any deaths. The increase in cases is due in part to increased testing. but the percentage of positive tests has also climbed in the last 2 weeks. Hospitalizations also continue to tick up as the state announced 98 more hospitalized Sunday. As of Saturday, 677 were hospitalized across the state, an increase of 28 from the previous day, and the 8th straight day hospitalizations increased. Read the full story here. Miami Seaquarium reopens. 12:15 p.m. After more than 3 months closed because of the COVID-19 pandemic, the Miami Seaquarium reopened its doors to the public Saturday. Like the theme parks across Florida, the Seaquarium is taking an abundance of precautions to combat the coronavirus. Face coverings and temperature checks are required, and the Seaquarium will run at reduced capacity with hand sanitizer stations placed throughout the park. Read the full story here. DeSantis tries to reassure Floridians as cases spike. 11:15 a.m., Governor Ron DeSantis issued a rare Saturday news conference to reassure Floridians about rising cases of COVID-19 in the state, saying that the vast majority of new cases are from young people who don't have symptoms of the disease. The governor pointed to low hospitalization rates, increased testing, and the median age of a person with COVID-19, which fell to 37 last week. Early in the pandemic, he noted, only people with symptoms could be tested. Still, DeSantis' address came on the same day the Florida Department of Health reported a record 4,049 new cases of the coronavirus. Read the full story here. Grim Reaper visits Trump National Doral, Miami. 10:15 a.m., Florida lawyer Daniel W. Ulfelder, who has gained a reputation throughout the COVID-19 pandemic for showing up in various places dressed as the Grim Reaper, continued his Grim Reaper tour on Saturday in South Florida. With cases of the coronavirus climbing across Florida, Ulfelder stopped by Trump National Doral, Miami, a golf resort owned by President Donald Trump, hoping to get leaders and people in general to take the danger of the virus seriously. Ulfelder said he believes leaders ignored the call to action. He's also angered by the failure to help small business owners and the unemployed amid the pandemic. Read the full story here. FDA issues warning about 9 hand sanitizers. 9:45 a.m., hand sanitizer was one of the hardest to find products throughout the early days of the COVID-19 pandemic. Now the Food and Drug Administration, FDA, is warning 9 hand sanitizers, all made by Mexican company Esc Biochem SA to CV, might be toxic because they contain methanol. On Wednesday, the FDA recommended Esc Biochem recall the 9 sanitizers. After the company didn't, the FDA issued a warning about the 9 brands: All Clean Hand Sanitizer, Sonoderm Advanced Hand Sanitizer, Esc Biochem Hand Sanitizer, Clean Care No Germ Advanced Hand Sanitizer 75% alcohol, Ovar 70 Gel Hand Sanitizer, The Good Gel Antibacterial Gel Hand Sanitizer, and Clean Care No Germ Advanced Hand Sanitizer 80% alcohol. Read the full story here. Catch up to start the day. 9 a.m., here are the coronavirus headlines to catch you up on what's happening around South Florida and the state as Sunday begins. Florida's Department of Health on Saturday confirmed 4,049 additional cases of COVID-19, continuing a record-breaking streak for the most new cases reported in a day. The state now has a total of 93,797 confirmed cases. As Florida reported another record day of new confirmed COVID-19 cases on Friday, with 3,822, Governor Ron DeSantis pushed back against suggestions that the state may become the next epicenter of the nation's coronavirus pandemic and that it's quickly running out of hospital beds to care for patients. Miami-Dade County closed 3 restaurants for violating COVID-19 safety guidelines, and the owners could face jail time. Miami Mayor Francis X. Suarez, meanwhile, dined Thursday at Swan, one of the restaurants closed because of the violations. On Monday, the mayor held a press conference to sound to alarms and reiterate the importance of social distancing and wearing facial coverings. The president of the Florida Medical Association on Friday advised local governments to require the use of masks in public as coronavirus cases continue to rise, putting the organization at odds with the governor, who has declined to issue a statewide order on wearing face coverings. The Shark Valley Visitor Center at Everglades National Park will be slowly reopening. The center opened on June 1st, but now bikes can be rented again and the tram has been reopened. Cruise Lines International Association, the cruise industry lobbying group, announced Friday its member lines, including South Florida-based Carnival Corporation, Royal Caribbean Cruises Limited, Norwegian Cruise Line Holdings, MSC Cruises, and Virgin Voyages, will cancel United States cruises though mid-September. In Miami-Dade County, $10 million in rent relief was ready to go, but now it's on hold until July after a county commission showdown. When Eric Beale and Kenan Jones quit their jobs, bought a boat and set sail in 2018 to circumnavigate the globe, they expected to hit a few hurdles.
All right. I just thought that was quite necessary to hear, because you're going to hear how even more so these numbers changed. And this was, I should have told y'all firsthand, was reported June 21st. So y'all seen the various memes that I was showing, you know. They love to spout fake news, but when the enemy wants something to go away, then they will report fake news. This dude, like I said, he wear dum-dum all over his face, And we see here, wait a minute, where is it at? Oh, his dumb ass don't even know how to put on a face mask. You see how this shit's dangling? He got it, he ain't figured this shit out at all. So they feel like when they speak things, because you know how, he tries to model Trump, that if they just speak it, it'll just go away. My royal family, I can't emphasize to y'all how serious this is. So let's get into this last one so we can hear what comes out of the horse's mouth.
A couple things. One, I think we're finding out a lot of new information about what's going on. You do have visits, but they tend to be younger people, and then even the hospital admissions have skewed younger, and there's been less acuity, and so that's just the reality. So that's why you go back to April to now, the ICU COVID hospitalizations are down significantly than where they were. And so those are things that obviously, you take into account. But I think that given that we're seeing the spread with the younger population, they are less risk. I mean, remember in Florida, 86% of the COVID-related fatalities are age 85 or above. And in fact, 65 or above, sorry. 65 or above, and there are more fatalities over the age of 90 that are related to COVID than are under the age of 65 combined. So the at-risk group is something we've worked on. We were able to test, or at least offer a test to every nursing home in the state, both staff and residents. Now we're going to be periodically testing the nursing home staff every 2 weeks to make sure it's not brought in where it would harm those nursing home residents. And that's something that's very appropriate. And I think if you look compared to other states, if you look at the long-term care resident fatalities per capita, we've obviously done a lot better than many of these other states. I think it's because of some of those actions we've taken. But if you look, the vast majority of the COVID-related fatalities that have happened, certainly since May, have been long-term care related. So that is where we need to continue to put the effort. The general public has continued to decline. You haven't seen high mortality, and so obviously we want to keep that going. But again, the cases are one thing, and then we are obviously looking at what's happening with some of the visits for some of the symptoms. And one of the things that's happened is because we went from not caring, not we, but the media didn't care about this for 2 weeks with the protests. I mean, that was off the front page. And then that was kind of doing that. And then when that died down, this became something. And it has affected people in terms of they're going to get tested. I mean, you look, we were begging people to get tested a month ago. And now you see people going to get tested. I think part of it is you're seeing more people, make these visits because they're concerned about some of the stuff they're seeing. So we're going to see, we'll be able to see how it shakes out. But I think we understand, particularly in the Tampa Bay area, particularly in Central Florida, we're definitely seeing the younger demographic in those areas that are testing positive at higher levels. You are seeing stuff in Broward, Dade, Palm Beach, but it's probably, at least in Dade, I think it hasn't skewed quite as younger than they were, but probably not quite in 20s and early 30s. And then some little bit in Northeast Florida. So we want to continue to work on that, work with them, and just make sure that people understand that. And we said this from the beginning. The virus doesn't just go away. It's something that we've got to deal with. It's something that, I'm confident we can deal with. And but people should just understand, just because it fell off the front pages didn't mean that it disappeared. Now it's back, I think, in terms of what's being focused on. So in some ways, even though I don't like to see, things about, oh, there's no hospital space for this, at least it's out there, and I think people are now thinking about it again. So some of these things, like these advisories, I think people are going to be interested in doing their part. And I think if we do that, I think things will be in good shape. I wish that I knew there would be more cases for sure, but I've been a little surprised to see some of the younger folks, the way that was. So we just want to make sure we're putting out the message, take the proper precautions, understand that, the social distancing stuff is still important. Even though you may not be as much of a personal risk, you can do your part to help stop the spread and hopefully protect those who may be a little bit more vulnerable to it. Thanks.
Yeah, all that fast talking, all that lying. So, as of now, Florida has added another 3,494 new coronavirus cases on Sunday as the state continue its, let me see here. Okay, they're testing. Where am I? Okay, right here. The state now has recorded 97,291 people on coronavirus, okay? At the current place, Florida will almost certainly hit the milestone Monday, and today is Monday, of 100,000. All right? 100,000. Like I said, what I was reading to y'all, like I said, this stuff is so fluid. It can change. It could change. Well, it says here it continues to be explosive. The trend of people are testing positive for the disease, here in this article here. And let's go back over here. So, when I started this video out, I said to keep on your frontal lobe about karma and the how nasty him and Trump were towards our brothers and sisters in the Caribbean. And they got a problem. But this motherfucker is so worried about money. That's all he worried about. And pleasing his zaddy, Trump. My royal family. What I want to say is, anyone that, and I had put it out, but I'm vocalizing it now. Anyone, because I can't keep up with everything. Anyone that I have sent out supplements to protect you from coronavirus, enough time has passed that y'all need to let me know if you're getting low. I don't want you to run out. All right? Anybody that wants to donate, because I meant what I said, donate at least $5 on a continuous basis, but I welcome the $1 too as well. And respect the person that sends the $1 that I feel like, you had to squeeze that up out of you. So I wasn't just saying that to get some damn donations. I sent out supplements. And the kind of money that I'm making on YouTube is real janky. So y'all know who y'all are. You know who I send this stuff out to. That don't wait till y'all get to the last minute. I will make sure I put up the necessary links. I welcome the donations, and this is continuous. Like my husband was saying, the angel of death is out here. And we've been dealing with, we normally deal with in the black community, police brutality, the outright slaughtering of the royal family. And, they want to focus on things like, oh, they're out there looting and stuff. And I forget that guy's, I think his name was Trevor Noah. He said something real deep. He said they keep talking about looting and all these things. He said they looting us by killing us. So we don't give a damn about that. All right? We got folks out here dying. We got to worry about a bullet and we got to worry about coronavirus. So I wanted to put that out there, my royal family. And if you can, stock up on your supplies because they're going to shut back down. whatever state you in, they're going to shut back down because this second wave going to hit hard. I was even reading yesterday that over in Europe, they get knocked down. We can't go by what these people say. You come up with your own protection plan for your own individual family, you know. And if you can afford to take supplements and you want to know about it, if you can afford it, email me behind the scenes. The people that I've been sending stuff to, please don't run out, because a lot of y'all I send stuff to, y'all had royal babies that I had to also send y'all a little something extra so the royal babies can take something too as well. This is serious to me. But sucker like this, I'll have you dead, because all he care about is some damn money. Now think about in that region, they deal with hurricanes and stuff. Now they can get knocked down. People have to get rescued. And then when people get rescued, they ain't worried about catching no disease. So they're going to be hammered. It don't matter what space and time we are in. It doesn't matter what type of weather it is, because they was banking on, well, when it gets warmer, like when it's the flu, that it'll magically go away. Coronavirus is here to stay. And I'm telling y'all something I know. Don't put your babies in no type of sand. No going to the beach, no going to the park. Sand is filthy. People shit and piss in there. You got animals doing what they doing, and coronavirus is in that sand. That's a perfect toxic environment. It's it's like a petri dish. So if anybody got that stuff out there, they're gonna catch it. And I mean, they so worried, even they thinking about like with the athletes. It doesn't matter professional or non-professional, these colleges and everything, they thinking about canceling the season just outright, period, because folks is testing. You making human contact and everything. So I wanted to re-emphasize this because we have been reporting on, which is extremely important to us getting literally continuing to get slaughtered in the streets of America. I put jokes, I put up videos to laugh and joke sometimes. That's just to lighten up. But I'm a very extremely serious person, and I'm very worried about coronavirus and our royal family. This is serious. And they the epicenter, Let's not dance around it. That's why I put the title that I put. And like I said, like I told Lisa behind the scenes, I said I've been focusing on Florida for a long ass time, and it came in fruition. And let's not lose sight, my royal family, because I haven't had an opportunity to do it. We are directly in the retrograde phase, all right? Directly. And I put up a retrograde video. Y'all can look and see it. It ain't too far down the line somewhere in my news feed and everything else. So retrograde will be over with next month. But I will remind you, or you can remind me too as well, because there's so much going on. I'm not really focused on retrograde, and I've done enough videos on retrograde that we know what time it is. So my royal family, render your voice with your beautiful divine words, and as always, my royal family, I thank you for your love. I thank you for your support. And with that said, Ashe.